Good evening, everyone. Good evening. Thank you all for coming out. We appreciate you coming out on a nice summer night. The summer's not over yet, but we still have a few weeks left. But before we get too comfortable, could we all please rise for the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you all for coming. We appreciate you coming out tonight. Welcome to We the People, a community conversation on healthcare. My name is Chris Rieger. I live in Cranberry Township. A little bit of background on myself and what exactly I'm doing here. I live in Cranberry. I practice law. I have a small firm on the south side of Pittsburgh. I do mainly consumer bankruptcy work and consumer protection under both federal and state law. And there are a number of reasons why people come through my office seeking help, who find themselves in financial dire straits. If they're going through a divorce, they had a loss of income, a business failed, any number of reasons. The number one reason why, as you can imagine, why people come into my office, and pretty much every bankruptcy practitioner in America, is medical debt and medical reasons. It is the runaway champion. The Kaiser Family Foundation, along with the National Institute of Health, did a study late last year. About 60% of all bankruptcy filings nationwide were caused by medical reasons. The New York Times reported that 1/5 of Americans under 65 have problems paying medical debt, and 2/3 of that group have claimed to use up all of their savings to pay their medical bills, sometimes just for the premiums alone. So this is an issue that's kind of near and dear to my heart, but I can go on and on. Tonight isn't about spewing statistics back at you. You don't need to hear that. It's not about getting riled up like a bunch of people with their hair on fire. It is to learn. It is to learn what we have now and what we might be able to do about it and what some of the solutions might be. First, I want to mention the genesis of this whole thing. The format of this evening has been tinkered with for a few months now, and I think tinkered with is kind of putting it lightly, depending on what was going on down in D.C. over the last few months. But we are not a legal entity in and of ourselves. We are just billing ourselves as concerned citizens of Western Pennsylvania. That's it. That's what we are. And we wanted to do originally the thinking was we wanted to do just a straight up town hall with a congressman who was going to show up or not show up. And then, that was reflecting kind of the feeling with a lot of citizens across America have been having with their elected representatives, particularly with the healthcare issue over the last 3-4 months or so. So then that evolved to, well, let's include a few of the Western PA reps. Then we wanted to incorporate experts, and then considering we weren't sure, again, what was going on and how things were going to end up down in D.C. with the Affordable Care Act, we wanted to kind of broaden and expand our approach a little bit. So we just went with community conversation on healthcare. We have invited federal reps, our two U.S. senators, U.S. Senator Pat Toomey and Senator Bob Casey, and we've invited 3 members of the Western PA congressional delegation, Representative Keith Rothfuss, Representative Tim Murphy, and Representative Mike Kelly. So this was billed as a town hall style event, not a strict town hall per se. We're going to hear from our panel, of course, first, and they're going to give us some background about where things are right now and where we might want them to go. But we're going to hear from you. We want to hear from you. We want you to fill in the details of what we're all going to be talking about tonight with your questions, your personal stories, and towards the end of the program, what some of you might want to see done with America's healthcare system. So, do some housekeeping out of the way. The format, we're going to hear from our panel in a few minutes, but the format, even as our panel starts talking, if you have a question or concern or you want to share a story with the group, just raise your hand, and we have 2 wireless mics circulating around. Where's Linda and Allison? There you are. right here with the bright red shirts on. So raise your hand. They're going to be on the lookout for you. They'll come back to you, have the mic ready to hand off to you, and then once our panel gets done finishing up a quick topic or whatever, they'll hand the mic off to you and you'll ask the question, and then it'll just kind of be a nice give and take back and forth for the remainder of the evening. So much of this evening is going to depend on all of you, okay? So before we get to our panel, before we get started, we are going to have someone kind of start us off on the right foot. We're going to have Patrice Tomczyk of Butler County. She was nice enough to come here tonight, and she's going to speak for a few minutes about how the healthcare issue has affected her and her family. So, Patrice, the floor is yours. If, Linda, you want to circulate the mic to her.
I can just stand here. We can be casual, right? You want to come up? My name is Patrice Tomczyk, and I live in Butler County, and I wanted to share our story, and I say our story because he's the hero. So when Carson was 3 years old, he was diagnosed with leukemia, and as you can imagine, it turned our lives upside down. He was incredible through it all, and he absolutely loved going down to the hospital. They treated him like a king. He loved his doctors, loved his nurses, and he was a great child. I do have notes here just because I want to keep on track. When you are in that kind of situation, you hit a point where you depend so much on the doctors, on the nurses, and on God. And all you do is you concentrate on healing, on getting that person healthy again. And while you're navigating the whole nightmare, you're going through a process. And his process included operations to put chemo ports in, spinal taps, many spinal taps, bone marrow aspirates, transfusions. I actually lost track of the amount of transfusions, and he had to have some white blood cell transfusions, which are extremely expensive, $10,000 each time. He went through chemo for 3.5 years, and it was a very long journey. I know that we have racked up huge amounts of bills. Thankfully, we had really good insurance, and there was a provision that was in Medicaid that qualified us based on his diagnosis for Medicaid to help us with the copays, because even the copays would be astronomical. And I often wonder, what if we didn't have that? And that was reality for some of the folks who were there at the hospital. And you get to know these folks because you spend so much time there. And I'll never forget the one family that was there. Their daughter was the same age, and I believe that she had a neuroblastoma. And I'd seen her at one point and saw it at another point, and she was visibly shaken, so was her husband. And what had happened is her husband had lost his job. They were going through their treatment. She didn't know what she was going to do. She knew she was going to go back to work full-time. She was a part-time nurse. The husband, I believe he was a carpenter. And so this was a huge issue for her. And I remember thinking, my goodness, how hard it would be not only to go through this, but have to worry about the money, the financial part, have to worry about losing your house, the food, because you just don't have the money to pay for both. And so this is something that is very dear to us. And what we brought here are Carson's beads of courage. And so there's lots of children who have these beads, unfortunately. So there's 3 strands. Do you want to separate them out a little bit, maybe? There's 3 strands here. And each bead stands for something that he had. Like I said, they can be injections, bone marrow aspirates, but you can see that There's quite a bit. And there's kids that have longer strings than this. And so this unfortunately also represents the amount of money that is needed to get a child healthy. And we're very thankful for Carson to be as healthy as he is today, and he's in remission. But the healthcare situation is a serious situation for money, and we need to have a fix for a lot of people who are struggling. So that's what I just wanted to talk about. Thank you.
Thank you, Patrice. Thank you very much, Patrice. That's why we did this tonight. This issue is people's lives. That's why we're here. Again, we're going to hear from many more of you throughout the evening. If we don't get to you tonight, if we run short on time, you can submit, our panel's still active online. You can get in touch with us on Facebook. We are at We the People Talk Healthcare. Facebook.com/We the People Talk Healthcare. Very catchy. That's all one word. So you can submit a public post, send us a direct message, and we'll get back to you. We can keep the debate going because it's far from over, obviously. So, well, I'm going to shut up, and we'll get to our panel. Again, have your questions ready. Once our panel starts talking, get a hand up whenever you want to say something. Linda or Allison will be around. First up, on my immediate right, way down at this end of the table, is Steve Larchick. Steve is a Pittsburgh area attorney and health law reform advocate. He runs the site healthcarepolitics.com, that is healthcare-politics.com. And he has a weekly podcast and radio show, Healthcare Politics with Steve Larchick. So thank you for coming, Steve.
Thank you.
Moving one down on the table, we have Stacy Vernalis. Stacy is a retired attorney and health law expert, and you could say she is an Affordable Care Act survivor. She has a pretty remarkable story that she's going to share with all of you here in a few minutes. On down, next up is Jennifer Blatz. She is Associate State Director for Community Outreach of AARP Pennsylvania, and she will give us her thoughts on what works in healthcare, what doesn't, and what we might need to do to fix a broken system especially for America's seniors. Next up is Janet Hill. She is the National Vice President of the Coalition of Labor Union Women, and she will be giving us her views concerning the economic impact of the healthcare industry. This is obviously a moral one, but we're talking about something that's 1/6 of the American economy, so there's a jobs aspect to this discussion as well. And last but not least, way down at the other end of the table is Erica Frick. She is the Health Policy Director for Allies for Children in Pittsburgh, an organization composed of civic and community leaders and volunteers that seeks to improve the lives of children in Western Pennsylvania. So again, have your questions ready. But Steve, I'm going to start with you. The House and the Senate the last few months, they were tossing one bill back and forth. One passed one chamber. Then the Senate was doing their thing, and it just kind of fell apart last week, actually. So as we sit here, the Affordable Care Act, Obamacare, is still the law of the land. So you have a lot to say, but I have a two-part question to kind of crank your brain a little bit that you can answer whenever you want. But first part, what was Obamacare supposed to do, and what has it done? That's number one. And number two, is Obamacare in a death spiral? We hear that all the time, so the floor is yours.
Well, let's do a little history. Back in 2008, so many of us forget how critical the economy was. And healthcare was crashing along with the economy generally. Employers who might have been providing healthcare coverage were looking for places to cut their budgets. And so we had a precipitous collapse in the number of employers that were paying for health insurance, or they were demanding more from the employees to share that burden. So that was happening. You had rampant abuse by insurance companies who were throwing people off as soon as they became sick. You had situations where insurance companies were selling policies and people were faithfully paying their premiums, and then when it came time that they needed the coverage, they'd present themselves to the doctor or hospital, and they would then find out that whatever they had wasn't covered, or there was a very low deductible, or low cap, or very high deductible. It's amazing how people forget how bad it was. And that's what really prompted when we had, and I'll be a little political here, the miracle Congress of 2008, 2010. A lot of people want to pound that Congress, but they did incredible things in the midst of a horrifying recession and gambled their seats, which many of them lost in 2010 because they did the right thing for America. One of the things they did was the Patient Protection and Affordable Care Act. And the people that are against it like to call it Obamacare because they know if you call it Obamacare, a certain percentage of people will not like it just because it has President Obama's name on it. And if you ask, do you like the Patient Protection and Affordable Care Act, a much higher percentage will say, oh yeah, I like that. But that Obamacare, ooh, I don't like that. So to answer your question quickly, what was it supposed to do? Well, first of all, it was supposed to be revenue neutral. In other words, one of the things the president said was, I'm not signing anything unless the Congressional Budget Office will certify that it won't increase the deficit or it won't increase the debt. Now, a lot of people might be surprised that President Obama, who's considered this uber liberal, would say, I'm not signing it unless it's paid for, which is something you'd expect out of a Republican or a conservative. But President Obama said that's number one. Number two, he wanted to have protections for patients, and that's where the patient protection part comes in. And just to tick off the most important, you hear about these essential benefits that have to be in an insurance policy. What that means is if you're going to sell an insurance policy and call it an insurance policy, it's sort of like a gallon of gas. A gallon of gas should really have a gallon of gas. Well, an insurance policy should actually cover something. And so the essential benefits is the statement of roughly 10 things like hospitalization and drugs and lab tests and things like that if you're going to be in the insurance business, then you have to include these things. No pre-existing conditions. Back in the bad old days, if you had pretty much anything or even worked in a particular job that might be hazardous, insurance companies would just refuse to cover you. They were cherry-picking the healthy, the young, the people that were working in positions and jobs that had no danger to them. And as I mentioned before, in bad old days, you could be thrown off your insurance. You could have bought a private insurance policy and paid for 10 years, every month, never been late, and if you developed cancer, the insurance company would see, oh, this guy's got cancer. I see all these bills for chemotherapy. They can just throw you off. And you think, where's the fairness in this? And it wasn't fair, but it was perfectly legal. Well, part of what the patient protection part of the Patient Protection and Affordable Care Act did was to stop that, made it illegal. A lot of people like the 26-year-old thing, that if your kids can stay on your policy until age 26. It wasn't always like that. And even that one, the Republican conservatives are sticking with that because it's so popular that there'd be a rioting in the street if you took that away. Another is community underwriting. In the old days, the insurance companies would take a look at your company or you, and they would try and pigeonhole you by risk, how old were you, male, female, things like that. Well, part of what the Patient Protection Act did was it said you can discriminate based on age, and there's a limit to how much you could, or smoking, and that's it. You can't try and exclude people on any other basis. The second thing was Medicaid expansion. In the old bad old days, if you were single or you didn't have kids, it didn't matter how little money you made, you wouldn't qualify for Medicaid. That was changed, and so we expanded dramatically the number of people that would be eligible for Medicaid, which also dovetailed with the opioid crisis because many of those people also have an addiction issue, and with Medicaid, they could qualify for care. So the Medicaid expansion that you keep hearing about was really the thing that delivered the most new coverage to people. The fourth thing was the development of these exchanges, and that was designed so that if you had to buy insurance yourself, in other words, your employer didn't provide it and you made too much for Medicaid, you were a working middle class, you were going to be helped, you were going to be subsidized. If you went on the exchange, and you would theoretically have choices among various things, and in many cases, the average of what people pay on the exchanges is about $100 a month. But the rub there, in terms of is it working, is the deductibles have gone way up. And that effectively makes it so a lot of people, roughly a third, may have an insurance card in their pocket, but they can't use it because the deductibles and the co-pays are too high. On the Medicaid expansion, by the way, a key part of the Affordable Care Act was that all the states were required to expand their Medicaid. Under the way the law was written, all 50 states would have to do this, plus the District of Columbia. And to make that easy to swallow, the federal government was going to pay 100% of the cost for 3 years, and then it would pay 90%. I mean, who could argue with that? What a deal. Well, 15, 20 states argued with that, including Pennsylvania for a while. And they just said, we don't want anything with Obama's fingerprints on it. Even if it's free, we don't want it. And that's still the case in states like Texas, Florida, Georgia. Just between those 3 states, who could have had all these people insured essentially for nothing, they refuse, and as a result, over 2 million people in those 3 states alone don't have access to Medicaid because of the politics involved. What makes that even stupider is that the taxes that those states are paying, the people of those states, to help fund the Affordable Care Act are still being paid. They're just not getting anything back. Now, how nutty is that? I mean, how much did you have to hate President Obama to say, I'm going to pay the tax, but I don't want it back, even if it's free? I mean, it's beyond belief, but that's the case. The last thing about Affordable Care Act was the mandates. Now, the insurance companies, and people forget this, back in 2009, the insurance companies didn't fight the Affordable Care Act. And if you're old enough, you remember back in 1994, they did. They fought tooth and nail. Well, in 2009 and 10, they said, here's the deal, Mr. President. As long as you make everybody buy insurance or have insurance one way or the other, as long as you make every employer provide insurance, then we won't fight this. And the rationale was, if you don't make everybody come in, only the sick people will pay the money, and that will drive the price up, and then more people will stop buying, and that's the death spiral that you referred to. So the insurance companies said, as the price of their cooperation, you have to have these mandates. And so the mandates were challenged also, and the Supreme Court, to everyone's amazement, said they were okay. The mandates were fine, which, by the way, matched what the Supreme Court did on the Medicaid expansion side of things. I told you there were states like Texas and Florida and even Pennsylvania who didn't want the Medicaid expansion, even if it was free, and they went to the Supreme Court and said it's not fair that we have to be forced to take free money to insure our people. And so the Supreme Court listened to that, and they said, you know, you're right. You shouldn't be forced to take free money to insure your people. And so there are still 16 or 17 states that don't have the Medicaid expansion because of the political side of it. So let me just end with your question about the death spiral. As I already alluded, once the death spiral happens when you don't have the pool of people participating, the healthy, the young, with the old and the sick. If we're not all in the same boat together, the young and the healthy aren't going to pay because, hey, I'm young and healthy, I'm immortal, you know. And so you only have people who think they're going to actually use the insurance signing up, so they do use it, and then the price goes up, the insurance companies lose money, and so they raise the price, so even the people that are buying it can't afford it anymore, and they drop out, which just makes the whole thing worse, and then you enter in a death spiral. And that is what some people say is happening, but in fact, it's not happening. What's happening is that now that we've had a change in regime in Washington, D.C., the president and Tom Price, the head of Health and Human Services, are manipulating the regulations to make it even tougher on these various insurance companies. They keep talking about bailing out the insurance companies. Well, the insurance companies aren't getting bailed out of anything. That was the deal. The Affordable Care Act was, you sell the insurance and the federal government will subsidize the people based on their income. And so when the insurance companies deliver the goods, the insurance, and they say, okay, where's our subsidy? When the president says, well, maybe I'll pay you and maybe I won't, month to month to month, insurance companies don't like that. They sort of get nervous that maybe he means it. And therefore they say, well, we have two choices. We can either withdraw from the market, or we can raise the price, and that way we win either way. If the president says, okay, I'll pay you, well, then we get extra. And if we've raised the price and he doesn't pay the subsidy, well, then we're covered anyway. So when you hear about these dramatic potential disparities coming up in a month or two, that's what it's all about. And the difference is, in Rhode Island, they're looking at a minus 5% increase. Even with all this shenanigans, it's looking like in Rhode Island, they'll have a decrease in what the exchange insurance will cost. But in places like, I think it might be Delaware, it's going to be over 100% increase. And Arizona had over 100% last year. Of course, Indiana, where the vice president is from, had a 3% decrease. So when you keep on hearing, well, it's going to be this, it's going to be this, it's different state to state. So there you go. That's the Affordable Care Act in 7 or 8 minutes.
Stacy, the ACA, your ordeal that you went through.
I think we had a question.
Oh, we did. Okay.
Okay.
Linda?
My name is Miles Wuerl from Aliquippa. My question is why, trying to phrase this correctly, why is our side not being as effective as the Republicans are in trashing basically this whole plan? I mean, I understand that the states that opted out of the Medicare expansion hurt their people. And they're the folks that are talking about 200 and 300% increases in their premiums. Well, duh, you have no competition, you have no way to drive the price down. How do we get that information? Because I listened to their arguments on the floor, and all they ever talk about is how there's these triple-digit increases, and it's going to be worse next month, and we got one provider. And I don't hear our side arguing that. The senators get up and the House people get up and they never seem to argue the point that here's why you have these increases. And so people that don't spend every day thinking about politics can't understand, they buy this. And I'm trying to figure out, how do we get that message out?
Well, I'm not here to take a side tonight. Get me anywhere else and I will. But not tonight, not in front of this group. But I can tell you this.
This is a nonpartisan event, by the way.
I have done interviews for my radio show. For example, I went up to the Harrisburg rally for President Trump, his 100-day rally. And I also went to the Bernie Sanders event here a few weeks ago. And I didn't tell anybody which side of anything I was on. I just took my digital recorder. And between the two locations, I did over 40 interviews. And if you were listening to the interviews, the question was, what would you like to see in healthcare? And if I mixed them up, you wouldn't know who was in which line. What I'm saying is that by and large, people want the same thing. When I was up at the Trump rally, not one person out of the 26 that I interviewed said what I really want is tax cuts for the rich. Not one, okay? Yet that's what the House bill was all about, and even the Senate bill until they got smart and tried to take it out. So I don't know what it's going to take, but I keep on emphasizing this not because I have the answer, but because I have the question. And that is, how can you be living in Texas knowing that because of the politics of your governor, 1 million of your fellow citizens don't have access to health care when it would have cost the state nothing? How do you even believe that. Well, take that same extreme and just, that's the way it is in different degrees across the country. So I don't know the answer, I know the question, though. So.
Stacy, let's get to you. So what I was going to ask is, if your ordeal that you went through a few years ago, if that was pre-2010, pre-March of 2010, things for you would have turned out a little bit differently. Would that be fair to say?
Oh, yes. Oh, yes. Like Steve, I keep handy my little crystal ball. You remember in The Wizard of Oz, you could look in the globe and see the past and the future? Well, we keep that really handy. I'm going to tell you a little bit about myself, in that my Obamacare story is both personal, but I was also a business owner. I've been a business owner since about 1990. Always had shares of ownership in a law firm. So you see, while I owned a business, which is a law firm, I participated in the purchase decisions for that business for health insurance for my employees. But I also suffered a life-threatening illness. But let me tell you first about being a business owner. You know, I really got involved in healthcare benefits in 2003 when the executive committee, they had 100 employees. They're used to having low-cost, quality healthcare, choice of their physicians. You know, that's what they've been accustomed to. Because let's face it, over 49% of Americans receive their health care through their employer. And my story, I want to focus on that 49% as it relates to the Affordable Care Act. So, from buying insurance from 2003 to 2009, if you were buying it for your employees, it was brutal. I mean, brutal. How many of you owned businesses back then, before Obamacare? How many of you provided insurance for your employees? Okay. And between 2003 and 2009, how hard was it to look at your books and justify the expenditure per head per employee to keep that benefit? And also, how little did your employees actually understand what was happening in the back of the house of your operation? I was seeing the lowest increase in that time period I saw was 18%, the lowest, okay? Now, we saw coverage shrink, we saw deductibles grow, we saw co-pays rise. The highest quote we got one year increased our costs 48%. Now, we were able to negotiate. How did we do that? We went to the lowest bidder. It was only 38%. That's 1 year increase in what our premium cost was. So we started switching carriers every year. We started HSAs. We funded the HSAs. We funded more of the HSAs. We went back and forth between Highmark, UPNC, and U.S. Healthcare 3 times, okay? The churn was constant. The employees were disgruntled. They had to contribute more and more just in this 6-year period. We had a woman who had been with us 37 years, and in 6 years she had paid more than she had ever before. Okay. And how much fun do you think it was me trying to tell a working mother she can't take her kid, just diagnosed with juvenile diabetes the last year, to the doctor of her choice? That was real pleasant, let me tell you. They're like tiger mothers, working mothers, when it comes to their kids and their doctors. So, as an owner, we agonized over this decision. We saw this cost increasing more and more and more of our revenue. And our employees really had no idea how expensive this was becoming. It was hard to have the conversation with them because, you know, they were accustomed to getting this policy. They didn't understand what the back of the house operation was like. And so in 2009, along comes the ACA. And if you recall, this was supposed to be President Obama's Waterloo, for those history buffs out there. Waterloo didn't end up so well. So there was predictions on both sides of the aisle that this was going to be the ultimate takedown in the first full year of the president, turning his political capital over on health care. Look what happened to Hillary in '94. Why is he wasting his time on this? So we waited to see. Boy, let's get ready. We've had 18% to 38%. What's it going to be? It's going to be a doozy this year, right? Okay. Quite frankly, our increases were far less than anyone predicted. We now know, looking back at the time period 2008 to 2016, that employer premiums for health care for their employees did not skyrocket the way it was predicted. In fact, the costs for the mandates and the 10 items of care that all policies had to include, that affected the premium between 1% and 3% in the years 2010 through 2012. So more coverage, right? And if you're covering more things, you're going to think, okay, well, that premium increase is going to be rational. It's now covering more things. Our employees are delighted because why? They have predictable policies. And they know who they're going to, their doctor relationships are. So they still had to contribute, and we still had to contribute. We did have a bump in 2012. Across the nation, employers saw about a 25% increase in premium. But on the whole, between the period of 2008 and 2016, employer premium costs went up 43%. That sounds really high, doesn't it? Okay, doesn't it sound high? I mean, that seems like a lot. Do you know what it went up between 2000 and 2008? 97%. So for a business owner, the Affordable Care Act is not perfect. We have lots of ideas of how it could be fixed, but our employees had predictable health care that covered the things that mattered to them, and it covered their spouses with pre-existing conditions. How quickly we forget. Yes, we are paying more each year, but we planned for those increases, and they're rational. But nobody likes price hikes, and certainly none that seem arbitrary. But under the ACA, we were getting more care, better care, and preventive care, and our workplace transformed itself with these preventive care options. How many work in a place now where there's fitness clubs, and you get points for joining? How many get points for starting a no smoking club? How many have yoga? How many have eat right events? I mean, our workplace, we got points if we started these clubs, and you know what? It improved our workforce. It was team building. It was terrific. So here's where the myth that we're being told every day that all health care premiums went up is false. Yes, health care premiums went up in the exchange markets. But for employers, for 49% of the people who get their insurance through their employer, it didn't go up. So now I'm going to answer your question about how would my life be different if we didn't have the Affordable Care Act. Here's where my story gets personal. In September 2013, I came home from a business trip to San Francisco with a cough. Cough. I was training to go trek with my fiance in Nepal for 3 weeks in October. So I was paying attention to this. I paid attention, and so did 7 different doctors who I visited to talk about this cough that was getting worse, so bad that I couldn't finish a sentence. That's kind of a tough impediment for a trial lawyer to have. You kind of pay me to go in there and to be able to complete a sentence without coughing. But 7 doctors later, I learned that I had contracted a virus. I didn't have a cold. I had contracted a virus. And that virus found its resting place in my heart. And by the time I got the chest x-ray that disclosed that my heart was 4 times larger than it should be, my ejection fraction, or the heart flow, was down to 10%. They asked if I needed a wheelchair, who could take me home. They asked me how I got there. I said I rode my bike. So here I was in congestive heart failure, and in 3 months I was on the heart transplant list. My heart then failed very quickly, and I had to have a left ventricular assist device, an LVAD. But for the public's purpose, it's an artificial heart. They open you up, take out your left ventricle, put in a titanium yo-yo pump that does 2,300 RPMs, the wire comes out your abdomen. They offer you a purse. I've had a purse in my life. I asked for a Batgirl belt. In fact, I kind of looked like Batgirl. I had 2 batteries and like a Game Boy in the middle that I could just see what was going on. So I opted for the utility belt, and, you know, I plugged in to the outlet next to my bed at night. I plugged in to the cigarette lighter in the car. I actually shut the door on the wire at the Giant Eagle, and the siren that went off, you would have thought it was an air raid, and those people in that Giant Eagle parking lot, I don't think they've ever recovered. Yeah. So I was trying to beat back some antibodies that were making finding a match difficult when I suffered a massive stroke. By mistake, a home health care nurse had injected an air embolus that went to my brain. My brain tried to shut down everything. Fortunately, my artificial heart kept pumping, and blood circulated to all of my organs. So even though I couldn't hear, the only thing I could do was hear. I couldn't see. I gradually was able to speak. I went into 3 weeks of intensive, almost like 24-hour rehab. And 3 weeks later, I was able to walk out. It wasn't pretty. I dragged my right side, but I was able to walk out. And 2 months later, I received my angel heart. I'm 53. I was 54 at the time, but my heart was only 20, the same age as my daughter, Jameson, my rock. She was 20. That was tough. But I wake up grateful for every day, but most importantly, grateful for health insurance because, Chris, 3 months after my LVAD was put in, I lost my job. I was a single mother, had 3 kids, 2 kids in college, all were under 26, right? So can you imagine if I didn't have the Affordable Care Act, I lose my job, my disability doesn't start for another 3 months. So I'm without income for 3 months, 2 kids in college, and I have to go buy insurance. Well, what that would have looked like before the Affordable Care Act, I would have had an artificial heart, needed a transplant, and they'd already spent $1.6 million on me. So I was over the $1 million cap. So the answer to your question is, I would not have been able to buy insurance. Might have been able to buy some for my kids, but I myself would have been left with Medicare. And Medicare, the way it looked back in 2008, and the way it looked for many of the patients on the floor the 4 months I spent in Presbyterian Hospital during this process, it's not the answer. It's not perfect. It could be better. If we had a single payer system, it would be beautiful, as our president likes to say. But I'm not sure, and I'm not being dramatic, I'm not sure I would be here today. I'm not sure without the opportunity to buy the kind of coverage, because yeah, it's tough getting a heart transplant, but it's no picnic afterwards either. Post-transplant care isn't cheap. The chemotherapy drugs I take every month alone just to fight rejection are $3,000 a month. And I take 17 other medications, and depending on the side effects they cause, sometimes they put me in the hospital. Last year they put me in the hospital for a month. One gave me ulcerative colitis, and I had an uncontrollable bleed. Now, none of that would be covered if pre-existing conditions were allowed to be a disqualifier for coverage. And none of us with chronic illnesses want to be a burden on our family. We contributed to society. We paid our taxes. We paid our premiums. The biggest fear we have is being a burden on our families. The biggest fear we have is going through our savings and our retirement, losing our homes. The biggest fear we have is bankruptcy. Chris isn't kidding. 60% of all bankruptcy cases are because of medical debt. Medical debt that was incurred before the Affordable Care Act, that hospitals are still chasing people to collect. So, I continue with physical therapy. I go to speech. Let's give Allison, my speech therapist, a gold star. Round of applause. I'm getting through this. I have to have notes, but I get through it. I go for memory, because if I meet you tonight, I have to have tools to remember who you are, so I can see you tomorrow, I can remember your name. And I can't work my old job, but I do volunteer. I'm a spokesperson for organ donation. I'm an advocate for cardiothoracic surgeon, and I get people off the fence who are wondering whether they should get an LVAD or go for a transplant. I need health care to live as well as I can, and I have a lot to live for. I got married a year ago. Can you imagine some poor sucker marrying me? I'm no cheap date, you know. But he did. It's been a year. And I have a lot to live for. But during this incredible journey, I've met hundreds of people, hundreds of Pennsylvanians, good, hard-working people cut down by a health crisis. Some are young, some are older. They fear what I fear, and that's becoming a burden on their families. I've also learned that I'm one of a million, right? There are millions of people, millions of Americans just like me with pre-existing conditions that need access to health care. And I also know that millions of people love people like me. So there's millions of me and millions more that love us. And we aren't looking for handouts. We want health care to return to our lives. We want our children to be covered. We want their pregnancies to be covered. We want addiction services to be covered. So I try to represent those who can't talk, who can't walk, who can't march, who can't protest or write. And I'm not alone. I have people in my room, my people in this room. These are my people. And my people want to work with anyone of any party and persuasion to work to solve this issue because, as this Congress has proved, the Senate has proved, bipartisan is the only way we're going to get to the finish line. Thank you very much.
Thank you, Stacey. But before we keep going, does anyone have a question or a concern or a story they want to share? We have one right here. Linda, right in front of you.
I can
There it is.
We can hear you.
Okay.
You're good.
Congratulations. My husband had open heart surgery just a year and a half ago, and that's a traumatic thing to go through. But anyway, I'm here because I know that other countries in the world spend, what, 1/5 per person of what we spend in this country on health care. Why is that? Why are we so expensive? I often say, we do too many drugs, too many unnecessary tests. We don't need all that. But we do need good health care when we are sick. So wondered if anyone could answer that.
Who wants to take that?
Go ahead, Steve.
I'll take a crack at it. Well, it would be helpful if we didn't pay as much as we do for drugs. That would be low-hanging fruit. If right now we have a president who ran on lowering drug costs, and I pay attention really closely, and I haven't seen the slightest movement in that department, other than one meeting the first week he was in office. And in Congress, if you're paying attention, there's talk about everything else, but not that. So if you were looking for low-hanging fruit, that'd be one. We could probably save 10 to 15% just by paying what the United Kingdom pays, or Denmark, or Canada. So that's an easy one. But really, the biggest problem is the system we have with so many private insurance companies is about the least efficient way you could possibly do it. I mean, if you went out to design a system that is inefficient, you would come up with what we have. And so, as Churchill said, Americans will eventually do the right thing, but only after we've tried everything else. And we're still trying everything else. We haven't, gone to the right thing. We could easily reduce the cost of health care in this country by 25 to 35%, and cover everyone, easily, at the same time. It absolutely could be done. So why don't we do it? Once again, it's politics, and until people like the folks in this room realize, and I know lots of you are working, you're going out protesting Wednesdays with Rothfuss and Tuesdays with Toomey and everything else, and that's wonderful. That's what we need to do multiplied by 10. Because until they believe that we're going to hold them accountable, they're going to go where the money is. And the money is with the drug companies and, the business, extreme right business folks. So the reason the reason we're paying as much as we do is because we let it happen.
Yeah.
That's why.
My 2 cents on this is that we've modeled healthcare to reward providers by the number of procedures they perform. Their compensation is based on units. The units are agreed upon across the spectrum for doctors, for any kind of provider. And I learned this by negotiating the purchase. UPMC purchased the second largest oncology practice. And it's like Hertz and Avish. I represented the second largest. I wanted to see what the number one got. And when I saw it, it was all based on working, like literally dividing their time into 6-minute increments. Lawyers do that, but you don't think your doctor's going to do that. And so when you have as a model is the doctor gets paid more, or the practice gets paid more, the more procedures they perform. And the hospital gets paid for the more procedures they perform. And the insurance company, so they're going to get paid by insurance, hopefully. That's their model. So there's no restraint on this for-profit model. And the insurance companies pass it on to us. So it's not that Obamacare, the Affordable Care Act, caused these rises. The actual act itself, impact on the pool, population pool, and risk was minimal. But health costs are soaring because of this profit model. I'll tell you a story. When my dad passed away, God bless his soul, when it took him in, battery of tests, he was 76 years old. And I looked at the bill, there was a pregnancy test on it. I mean, he said he was flattered,
Stacey, earlier you mentioned Medicare finally, and I think, Jen, that's a good transition to you finally. Did the ACA hurt older Americans? What did it do for older Americans, and where are we at right now with Medicare? Do we think it's going to be expanded at some point, or where are we going with this, and what's the AARP's position? I know you can't speak directly for them tonight, but...
Well, I'm going to try. So thank you very much for organizing this really important discussion, and thanks for all of the panelists to be with us tonight. My name is Jennifer Blatz, and I am the Associate State Director for Community Outreach for AARP here in Western Pennsylvania. Normally, sitting in this chair would be Ray Landis, our Advocacy Director. Ray is on a much-needed and much-deserved vacation this week, so I am pinch hitting for him. My job typically is to coordinate the efforts of our volunteers in the western part of the state. I think a lot of people don't know that AARP, aside from all of the work that we do, you might receive mail from AARP. Has anybody here received a piece of mail? So you receive, hopefully if you're a member, you get our magazine, you get the bulletin, you might have purchased some insurance, the supplemental insurance to Medicare. All of those things are really important parts of what AARP does. But the role that I play is coordinating our volunteers. So I just want to say thank you to Debbie and Phil, who are in the audience tonight. They came down from Butler to help me collect signatures on our petitions. And this evening, once I read from these papers, and I have to read from these papers because if I don't, I will get fired. I can't riff, but I would love to talk to any of you who are interested in joining our advocacy efforts. I think one of the most successful parts of what AARP did in the last 6 months was mobilize our members. We were able to track 3 million interactions with members of Congress. And that's just what we were able to track. So that was emails, patched through phone calls, visits with members. It was an extraordinary effort, and I was really, really proud to be a part of it. Probably a lot of you in this room were part of those mobilizations. So whether you were contacting your member of Congress on behalf of AARP or another organization, or just as a citizen, I can tell you that has had a massive impact in Washington, and I think we saw the results of that when that bill thankfully went down in flames. Now I'm going to go to my papers. So AARP has been a nonpartisan champion for the 50 plus throughout our history, fighting for and equipping individuals to live their best life. In the recent healthcare debate in Washington, AARP was on the front lines fighting every day with the guiding principle of our founder, Ethel Percy Andrus, in mind. What we do for one, we do for all. And I also just want to share with you, I was on a conference call today with one of our executive vice presidents who was doing a teletown hall with our volunteers, and she shared a very kind of exciting and neat piece of information. Our CEO, Joanne Jenkins, who you might see on our TV commercials, received a telephone call from a very important person. President Obama called her and said that he felt as though AARP's involvement in the healthcare debate was really what turned the tides. He picked up the phone to call her and tell her that. So I thought that was a pretty great way to end my day. And also hearing the mention of President Obama's name made me feel a little sad. So onward. So I'd like to focus tonight on AARP's work to strengthen and protect particularly Medicare for all Pennsylvanians and all Americans, as well as our hope for the direction that this debate is going to take as we go forward. We've been around for about 60 years fighting for affordable health care and now especially against any attempts to cut Medicare. We've long opposed attempts to make older Americans pay more for their health care, and today we call that the age tax. Probably a lot of people in this room heard a lot about the age tax, and hopefully that will go away in our next round of discussions about what the Affordable Care Act will look like in its next iteration. We are encouraged that Congress appears to be potentially moving away from the partisanship. Senators Alexander and Murray have begun efforts to produce some kind of a bipartisan solution to at least potentially stabilize the exchanges. Hopefully that will continue. In support of these efforts, last week AARP sent a letter to all members of the United States Senate and the House of Representatives conveying the need for common sense solutions that will lower costs and increase healthcare access. And I'm going to share with you some highlights from that letter. Older Americans care deeply about their health care, and they need and deserve affordable premiums, lower out-of-pocket costs, and coverage they can count on as they age. We recognize that the current law is not perfect and believe Congress should focus on common sense bipartisan solutions that will increase coverage, lower costs, stabilize the markets, and improve care. We support strengthening access to affordable health care and oppose increasing costs through any kind of an age tax. Solutions to strengthen the ACA marketplace should increase enrollment and greater stability and competition within that marketplace, and eventually lower costs. There must be a commitment to paying for the cost-sharing reductions, which provide critical assistance to those with modest incomes, as well as improvements to the law's risk mitigation programs, such as through reinsurance, that'll help strengthen the ACA markets and reduce premiums. We support strengthening Medicaid and increasing access to benefits that allow older Americans to live independently in their homes and in their communities. And we support protecting and strengthening coverage for Americans with pre-existing conditions, and will continue to defend against any weakening of the protections provided under the law. So another reason that AARP believes that we need to remain vigilant against any attempts to repeal the ACA is the fact that some of these bills would have deeply weakened Medicare, shortening the life of the plan and leaving the door open to benefit cuts and vouchers. You probably saw that the Speaker of the House, Ryan, has been talking about vouchers for a long time, and that has really amped up in the last year or so. So we're keeping very, very, very close watch on that. This should concern all of us because Medicare is the bedrock of health security for all Americans as we age, helping to keep older Americans out of poverty and enabling them to live with independence and dignity. We pay into Medicare throughout our working lives so that those age 65 and over and people living with disabilities can get guaranteed health benefits. Today, 57 million Americans, that's 2,370,000 Pennsylvanians, rely on Medicare to help pay for their prescription drugs, doctor visits, and hospitalizations. And for those of you who aren't yet on Medicare or you don't know exactly what it is, it's typically in 4 parts. help paying for hospital bills, help paying for doctor bills, help with prescription medicines for those who choose to buy that additional coverage, and a choice between a traditional fee-for-service plan, which allows you to select your doctor, or a private insurance option like an HMO or a PPO that's popularly known as Medicare Advantage. So leaders in Congress have already revived talk about turning Medicare into a voucher system that would dramatically raise costs and risks for seniors and all Americans paying into Medicare, because essentially the new people who would be coming into the system would go into the voucher plan, and everybody who remained in the old system would see their premiums dramatically increase. And we've also learned that oftentimes people don't understand that as Medicare recipients, you are paying part of that. I think there's a misunderstanding for those of us who aren't yet in Medicare how it all works. So our members and most older Americans believe that Medicare should be protected and strengthened for today's seniors and for future generations. This requires an investment in Medicare, not cuts or any cost shifts. The ACA put in place a strong framework for developing and testing new ways to deliver care with the goals of reducing costs and improving outcomes. We support the work the Center for Medicare and Medicaid Innovation is doing to improve care coordination across Medicare and to continue to invest in waste, fraud, and abuse prevention. And finally, we hope that Congress will continue to explore ways to strengthen Medicare efficiently and effectively while delivering high-quality care at affordable prices for consumers. This is kind of a no-brainer, but that's what I have to say. Traditional Medicare does not cover hearing, vision, and dental, which Americans rely more and more upon as they age. So I think the obvious answer to the question is, how do we strengthen Medicare? Let's include those pieces into future iterations of Medicare. I hope you'll take a minute tonight to sign a petition in the back that Debbie and Phil were helping me to circulate. We are gearing up at AARP for a big fight about Medicare next year. So we're starting to gather names and information of people who are concerned about Medicare, and we'll compile all of those, and then we'll be ready for that battle whenever it comes. And my last bit here is about prescription drugs. Prescription drugs was a big part of AARP's involvement during the Bush administration around the expansion of Part D, and then again during the ACA fight in the early parts of the Obama administration. Any healthcare discussion must include solutions to combat the ever-growing problem of rising prescription drug costs. Older Americans use prescription drugs more than any other segment of the US population, typically on a chronic basis. We strongly supporting the closing of the Medicare Part D coverage gap, or what's typically known as the donut hole, protections created under the ACA, and would support an acceleration of that closure. Since the enactment of the law, more than 11.8 million Medicare beneficiaries have saved over $26 billion on prescription drugs. AARP urges that any changes to the health law also tackle the issue of high prescription drug costs, including steps such as giving the Secretary of Health and Human Services the ability to negotiate drug prices on behalf of Medicare beneficiaries. And AARP is ready to work with Congress and the administration on a bipartisan basis. I'll just close with a few statistics. Roughly half of all seniors in Pennsylvania are getting by on an income of a little more than $21,000 per year. And half of the people in Medicare, which is a lot of the people that I just described who are living on $21,000 a year, spend nearly $3,600 out of their own pocket on their health care. And 10% of people in Medicare spend over $10,000 a year. They don't have much in savings either. Only 1 in 4 people in Medicare has less than $10,000 in savings. And those are some very, very harsh realities facing a lot of us and a lot of people probably in this room. But we at AARP are heartened by the fact that millions of you mobilized and demanded more from our elected officials in Washington. So thank you so much for your time. Sorry to read from the paper, but that's just what I had to do. If you're interested in joining us in our advocacy efforts, There are some cards in the back, these little orange cards that say ABC, and on the back of them will show you how to sign up to volunteer, and it also has my email address. So I would love to hear from you. We do monthly advocacy phone calls where we just get updates on what's happening locally and kind of coordinate our efforts there. We have a really great group of volunteers that would be happy to have any of you join us. And also in the back on the table are some flyers for 2 events that AARP is organizing on August 21st and 22nd in Erie and Bethel Park that are very, very similar in format to this event. Panel discussion, we're calling it a community conversation on healthcare. So I would encourage any of you who know some folks in Erie or in the South Hills to please join us, and the event will be free and open to the public. And just a quick mention, unless somebody else is going to talk about it, about something really big and important that's happening in Southwest Pennsylvania on January 1st. It's called Community Health Choices. It's a very, very big change to the way people who are dually eligible for Medicaid and Medicare will receive their care. So if you remember nothing that I said tonight, just remember Community Health Choices. And please go home and Google it and learn about it, because it's a very big change for some of our most vulnerable citizens. And so I'm really trying to get the word out about that as well. So thank you.
Thank you, Jen. Janet, before we get to you, does anyone have any questions or concerns? We have one right here. Allison?
Hi, my name is Michelle Boyle. I'm a nurse. I've been a nurse for 24 years. I mainly worked in hospitals and some outpatient, and due to various situations, I'm now doing case management, which is, I didn't fully understand the donut hole until I'm the one who's now reviewing the charts, and it is gobsmacking, the donut hole, because they're like, oh, well, it'll only be a little bit more. No, you're talking about a medication that went from $100 one month to $700 the next because of the donut hole. That lands people into the ER. That is not cheaper, that is not better. I know I'm speaking to the choir here, but it was such a revelation of what it's like. And it's just astounding. And the good piece of news that I can tell you is a one woman who fell into that hole, and thank God it was only for an antibiotic, but it was for an expensive antibiotic, was that when we were talking about it, I said, well, the bad news is it's going to cost this much, but I said, you only have to pay for it for a month. And she said, okay, I can do that. She goes, but I am writing Senator Toomey again, and those guys are really sick of hearing from me. And I'm like, yes.
Good.
She was great. And the one thing that so far I haven't heard yet is that, we have been talking about healthcare, but, and even though the brain is part of the body, they do separate out mental health from healthcare, and that is also needed in Medicare. And that there are a lot of situations that are going on. And I can tell you the only reason why my computer doesn't go flying through my window when I'm dealing with some of these insurance companies is that I'm also running for state senate in the District 38.
Thank you. Well, Janet, let's get to you. I think that brings up a good point. Just there's the moral component, and then there's the economic component of this whole thing. So where does your organization stand in terms of, I look at it I can only speak for myself. I look at it from a moral perspective. I think everyone should have health care because it's the right thing to do. But the jobs aspect of this, as I mentioned earlier, we're talking about 1/6 of the American economy. So wouldn't it make sense to have a system that covers everyone? Janet, what do you think about that?
It absolutely would. But I do have a little question for the audience here first. Is there anyone in the audience that has never used their health insurance? Anyone? I just have to make the point. It's not like car insurance. I mean, I can take the bus to work and avoid ever using, hopefully, with better transportation I could, not using my car. But as Sooner or later, you got to use your health insurance. And I'm sorry, do you have a question in the back there?
There is, before we get too far away from the AARP, we did have one other question. Sorry.
Yes,
Okay.
my question's for Jennifer Blatz. What is ARP's position on a single-payer healthcare system, and are you steering our seniors in that direction to reinforce Medicare for all?
I personally have not heard that AARP is moving in the direction of single payer, but I think if we are going to continue on a bipartisan path, the more pressure we're putting on both sides of the aisle, that is ultimately the goal, is going to get us there. AARP will certainly endorse or support that as soon as we're certain that it doesn't do anything to harm the long-term viability of Medicare, for instance. So, and I do actually have some talking points here. It's essentially about the buy-in. So just this week, I think, Senator Tammy Baldwin in Wisconsin is introduced, or was it Duckworth? I can't remember which one. It was a Tammy. Introduced the idea of people who are younger buying into Medicare. And I certainly would believe that AARP would move in that direction, but we as an organization of 40 million members move very, very, very slowly. So the best way to turn the ship is to get as many people that you know engaged with your members of Congress. And I can tell you that during particularly the Affordable Care Act fight, people were sending AARP their membership cards burned in effigy. They were so angry that we came out in support of the ACA. So we learned a lot in that process about making sure that the organization is moving in the direction that is sensible for all of our members. And I think what is happening in the national discussion about healthcare now is that we are moving to a rational end to this crazy conversation, which is that we all have to be in one system.
Okay, well,
Thank you. Let's keep hearing from Janet. I think you were finishing up a point briefly. I'm sorry.
Oh, no problem. I mean, I think when you want to talk about, I'm happy to see that everybody uses their health care, because we should certainly all be using the preventative care that we get through the Affordable Care Act. But from an economic perspective, first of all, health care was one of the few sectors of the economy that bounced back after 2008 and the Great Recession. It came back virtually untouched. Part of that was because of demographics, but it was also the fact that people need health care. And whenever the Affordable Care Act came in, it certainly seems to me like it's common sense that if you give more people coverage, you're going to need more people to take care of them. You're going to need more people to process claims. You're going to need more doctors, you're going to need more nurses, you're going to need more physician's assistants. And, it seems to me that, well, yeah, did nobody, how many people here heard about the economic effects of either of the House version, which was the American Health Care Act that they were talking about repealing, and the Senate version, the Better Healthcare Reconciliation Act? Did you hear very much at all about the economic effects in terms of jobs? So a few of you did? Because, yeah, it depends on which version you were looking at and which estimate you were looking at. The one estimate was at least, and this was actually in the beginning of the year, said that it was just based on the repeal of Obamacare from Forbes, said it 2.5 million jobs. Now, one of them from the American Health Care Act said 1 million jobs by 2026. Now, like I said, it's pretty doggone obvious to me that any kind of a repeal is going to cause people to lose jobs. But the other thing is, you've got to think about this in another way. If someone loses their insurance, they're going to be very careful on how they spend money. And that means, because they're afraid of bankruptcy. So that means that our economy is going to sink even further. Then you've got the issue of people could not only have have less money coming in, and they're spending less money, so the economy is going to go down, but they could be employed in healthcare and lose their jobs. Plus, if you look in many of the rural areas, not just rural areas, if you look at, say, even Akron, Ohio. In Akron, Ohio, it used to be, since 2000, the number of manufacturing jobs has gone down by 40%. Guess what's taken the place of manufacturing jobs? Healthcare jobs. They've increased by 30%. And it used to be that the top employers were manufacturers. Well, in Akron, now there's only one company. They used to be the rubber capital of the world. Now there's only one company in the top 10 that makes tires, the top 10 employers. The other 3 are hospitals. So that should tell you something. I mean, it's been growing. Healthcare has been growing. There's been an additional need for it. Of course, people were getting older. But, we need to look at this in another way, too, because it's not just replacing manufacturing jobs. And a lot of that's happened in Pittsburgh as well. But if you look at a couple of the things here, I mean, we need to be looking even more at healthcare, because one of the things that came in with the Affordable Care Act was that they started to look at the way doctors were prescribing things. Because one of the big jobs is data analytics, and doctors weren't prescribing the best care. And when doctors don't prescribe the best care, you don't get the best results. And what we need to have is results. We don't need to have something, as you said, about paying on how many times somebody is seen or reducing the number of visits of people. We need the best care possible, and we need doctors to prescribe the most effective care possible. And that's another area that's been growing as we look more and more at this data. Like right now, you can go out there and, just as a hint for anyone, because prices are absolutely crazy, I mean, you can literally go on one end of town and get an MRI and go on the other end of town and have it be $500 less. And it's entirely possible that the MRI that is less expensive is higher quality, because there is really not a whole lot of rhyme and reason to the prices, except in certain areas where they've done a whole lot. But if you go out to fairhealth.org, you can go out there and you can compare prices, hopefully through your insurance company. A lot of insurance companies have given people tools to go out and compare prices. And interestingly enough, one of the states that's been doing some innovation is Maryland, and they've been trying to do a system, well, I guess for the past 40 years, they've actually been negotiating prices with hospitals. It helps them keep the prices down. They have sort of what they call an all-payer system there, which is pretty much what 5 different countries have. But as we go through and as we get more people covered, we're going to need more people in the healthcare industry, and we're going to need more people trained, more jobs, and this could be a great growth factor. A lot of hospitals in rural areas have gone under. They are still going under. They're going under at a lesser rate because now people have insurance to pay for care. Once again, it just seems to me like that is common sense. And in a lot of the rural areas, hospitals are economic growth generators, because in many areas, they are the largest employer in that area. Much like Akron, where they're one of the largest employers, they are also the largest employer in the area. I can tell you that I believe that the medical center in Beaver is one of the largest employers in the area. And they can be a great, they can help build up infrastructure. And I believe they're going to be a continuing, all the predictions are that they will be a continuing growth generator, but not if we cut back on the number of people covered. And it's utterly nonsensical, once again, that whole common sense issue, that we had senators that were talking about how they wanted to increase the risk pools. And basically, I don't know if anybody knows what a risk pool is, but that's basically saying we're all better off together than we are apart, because there are some sicker people that are out there that are mixed in with a lot of healthier people. That's why they wanted the individual mandate, so that younger people would come in, the healthier people would buy health care. And there's nothing more than having everybody together that would be the biggest risk pool that we could have. So it's kind of crazy that they talk about, well, we could sell this across states. Well, if you put everybody together in one risk pool, so everybody had the same health insurance, we could actually eliminate a lot of complexity. We could eliminate a lot of the people who are fighting against each other to not pay your bills. We could actually generate a lot more growth if we actually went ahead and did that. So that's pretty much what I wanted to say, but I did want to point out that I have a friend who, her son went to Norway. He has a shellfish allergy, and he ended up going to the hospital a couple of times. He's never had any problem getting coverage. As a matter of fact, he walked to the hospital in spite of the fact that he was having respiratory issues because of his shellfish allergy. And their comment to him was, hey, you could have taken an ambulance. You're not in the United States anymore. I'd like to leave it with that.
That is fantastic. Before we begin to wrap up and kind of discuss where we're going from here, I did want to touch briefly upon the AHCAA and BCRA. And Eric, I think we haven't heard from you yet, so we got to hear from you on this. I think one of the most detrimental aspects of what was getting tossed around in the House and Senate was the absolute gutting of Medicaid, block granting, caps, whatever you want to call it. That would have put, Eric, it seems to me, would have put a huge strain on the taxpayers of the state if many states were even able to pick up the bill. Harrisburg's not doing too well financially right now, so one of two things, it seems to me, was going to happen if that were to go through. Either taxes are going to go way up for folks in the Commonwealth, or several 100,000 in Pennsylvania were going to lose coverage under Medicaid, including children. How would that affect an organization like yours?
Well, thank you for that question. And thanks for putting on this forum. It's wonderful to be here. I'm going to stand up just because actually, and if anyone else wants to stand up too, it's hard to sit for an hour and a half.
Yeah, no kidding.
And it's wonderful to be here today, particularly because I came from the hospital. I was at Children's Hospital Pittsburgh today with my son, who is 10 years old, so I was looking at Carson and having big feelings. But it was for a same-day procedure because he had put beads in his ears, one in each ear. He had done this 5 years ago. So he's had beads in his ear for 5 years, and we found out about it about a month ago. When he said, it hurts because of the bead in my ear. And I was like, what do you mean? What do you mean it's hurting because of that? So anyways, there's lots of questions. We're not going to go down that route. But what really hits me listening to everyone today is, and particularly as anyone who's sort of lived with children or around children or loves children knows, you really can't predict when you're going to find out that your child has a bead in his ear, and you need to deal with it now, and it turns out it's going to be a same-day surgery because it's been there for 5 years, and if you don't do it, there's going to be long-term consequences. That are going to impact his ability for the rest of his life. And that's one of the reasons that, when we think about children in healthcare, it's not an option. And in Pennsylvania, we do an incredible job of covering children. 95% of children in Pennsylvania have health insurance coverage, which is really just something that we can be, incredibly proud of. In Allegheny County, actually, it's 98%. So we're doing a really good job, and that's because we've been dedicated as a state to making sure that kids get coverage. But I think what you hit on is really important, because people think of children's health insurance coverage and they think of the Children's Health Insurance Program, which is CHIP. However, most of the children who have public health insurance through Pennsylvania get it through Medicaid. And I have a bunch of really, I think, lovely fact sheets out there if anyone wants to grab them. But it's, for the statewide, children who are getting health insurance through a public program, it's 87%, almost 88% are getting it through Medicaid, not CHIP. And that's really important because they're incredibly different programs. In fact, when I'm talking about Medicaid, what I have been telling the state legislators we've been speaking with is, before you start sort of thinking about changes to Medicaid, step back and realize Medicaid is primarily a children's program. The majority of the beneficiary, not the majority, the largest group of beneficiaries of Medicaid in Pennsylvania are children. So here in Butler County, it's 42% of the Medicaid population are children, 43% statewide. And it's a huge payer throughout all of the service provision for children. So, of course, we know low-income kids, up to 138% of poverty generally, but also, to your point, Chris, special education. So children who have special health care needs, like Carson, can get health care through Medicaid, because there's an understanding that that adults will go bankrupt before they fail to provide coverage, care for their kids, right? And that when you're talking about whether it's a chronic condition or something like a special behavioral or developmental concern, something like autism, but you're talking about care that's 3 times a week from 3 different kinds of professionals, and co-pays that are running into hundreds of dollars per week for those families. So Medicaid supports those families rather than not give that investment in children's care. Similarly, you see that with, if you talk to people at Children's Hospital in the oncology unit, many of those families are lucky enough to receive Medicaid to take care of their kids. So that's something that's sort of a major impact for families, but also within the school system. Because as people probably know, we are required to cover and provide services for kids through special education, which is really important, and Medicaid supports that. So to your point, Chris, if Medicaid goes away, we're still providing the services in schools for kids. Medicaid is no longer supplementing that. And so that's a cost that comes either directly out of the classroom or out of the local tax base. That's one area that we would see the cost shift. Another is people say, well, we've got the CHIP program. CHIP is a block granted program. That means there's a set of money that comes from the federal government, goes to the states to distribute. And it's covering, as I noted, a much smaller percentage of the kids than Medicaid is. What makes Medicaid so special is for children, a child who needs a service, as considered by their provider that they're going to need this service, they get the service. And that's very different from saying, you get $50, choose, and using that $50, decide what your child's going to get today. And so it's a difference, I think, both in what's going to happen on the ground for local communities, but as far as a long-term investment in our children and in our communities, that would be a major implication for us as taxpayers. So I think that answered your question. And thanks again for the chance to be here.
Thank you, Eric. Cardinal Wuerl's probably going to kick us out, but one quick question, and Steve, I think you would be the person to answer this very quickly before we all go home for the night. Where do we go from here? It seems there's one of a few different paths. We can put a Band-Aid on the ACA, toss some money at it and call it a day, and that's that. Or do we have a transitionary period where we kind of put more people under Medicare and put up some sort of public option arrangement? Or do we live under old Soviet Russia and go to single payer? We all visit the same doctor. Is that how it works, or no?
Well, my crystal ball says that what's going to happen is we'll take the Band-Aid approach, and that's because all of the efforts to take the extreme conservative approach have mercifully failed. And so now we'll basically fix the Affordable Care Act, and in such a fashion that everybody could claim they won. And then simultaneously, Senator Bernie Sanders will roll out his Medicare for All, improved Medicare for All bill, and that will start getting the debate this fall and next spring, and that will be the principal issue that will define the 2018 congressional race. That will be the binary choice for Americans. We like binary choices, black and red, things like that. It's easy. So if what happens is that in 2018, it's a referendum on Medicare for All versus what we have now, I like the chances of Medicare for All, and so that may very well be what happens. So that's the short answer.
Final show of hands. Raise your hand if you think there is a moral obligation to provide health insurance for all American citizens. Health care. Thank you for correcting me. There we go. So we have to wrap up. We're already over time. Again, I don't want the Cardinal Wuerl's been fantastic letting us use this venue. A couple quick things. This obviously is not the finish line. If the debate's just getting started and it's ongoing. If Americans felt that it was okay that medical issues cause so much financial hardship for millions of people, if Americans felt it was okay that we were the only developed nation in the world that did not guarantee health coverage to its citizens, if Americans felt that the system was working the way it should be, we would all have been talking to a bunch of empty seats tonight. We didn't. You showed up, you shared your concerns, and you showed that people do care. So thank you for coming out. Give yourselves a round of applause first for coming out tonight. Give a round of applause to our panelists. They were outstanding. A thank you to Cardinal Wuerl High School. This is a fantastic facility, so thank you. And our group, as I said, this is 2 to 3 months in the making. Our group was between 12, sometimes 15, to at times 20 people putting this thing together. So the group is too numerous to mention, but one person I have to acknowledge, the brainchild behind all of this, Catherine Lalonde, stand up and take a bow. Thank you for putting this together. There are donation jars. You may have seen donation jars. Nothing good is free, so this venue is not free. We're still paying for this thing, so any money you can donate to help pay for the venue, any excess will be donated to local food banks, so keep that in mind. Last bit of advice, I guess, from all of us. I mentioned earlier that the purpose of tonight was not to, have people running around with pitchforks and torches like you see at a lot of town halls the last 5-6 months, even though I love seeing that personally. It was to have a purpose. The purpose is to influence public policy. And how do you do that? How does that start? Email, call, go to town halls of your legislators, your reps. And I know you're being cynical, but keep doing it again and again and again. And you say, well, Chris, I've done it numerous times. And then I'll say, do it again. Do you guys remember the movie Miracle about the 1980 men's Olympic hockey team? There's a scene in there, it's brilliant. Kurt Russell plays Coach Herb Brooks, and he's infuriated at the end of one of the games with his team's poor performance and lack of effort. So after the lights go down in the building, he keeps them there for hours and hours, just doing drills back and forth on the ice. And he just says, again, 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 again. That is the approach I think we need to take with our representatives. So if you say, I've called, I've written letter after letter, email after email, and he hasn't gotten back to me, he's not responsive. And I said, do it again, again, again. And let them know, if you do not listen to the needs of your constituents, if you don't show up for town halls, if you don't make yourselves accessible, if you don't represent our values, if you don't reflect our values, we will replace you especially next year with people who do. So keep that in mind. We do have a few we heard from one tonight already, but we have a few candidates in the crowd tonight. Raise your hands, be acknowledged. We got a few minutes if you want to hang out and meet with them. The rallies are great, the marches are great, having your huddle groups is fantastic, but take that enthusiasm a step forward and put people in elected office that share your values, okay? Democracy is not just voting. Democracy is participation. And without participating, democracy doesn't work. So keep that in mind. Be safe going home tonight. Take care of yourselves. Take care of each other. Stay active. Thank you very much. Outgoing music, too.